Hello, my name is Erica Metzler-Sawin, and I direct the Undergraduate Primary Care and Rural Education Project at James Madison University in Harrisonburg, Virginia, as Diana said. Thanks, Diana. Today, we are presenting Demonstrating the Value and Sustainability of the Enhanced Primary Care Registered Nurse Role in Federally Designated Rural Health Clinics, a QI project. The UpCare project is funded by a HRSA Nurse Education, Practice, Quality, and Retention / Registered Nurses in Primary Care Training Program grant. The aim of this presentation is to share initiatives that we have been implementing in rural health clinics utilizing the work of registered nurses. We will address issues related to sustainability, quality, and access, as well as describe barriers to RN practice in that environment. The objectives are written here. First, let me back up and give you a brief grant overview. Here's our UpCare grant logo, which notes that the UpCare project can be used in nursing education to teach students about the big picture in a small rural place. This 4-year HRSA grant project was funded in 2018 and was mainly created to establish a primary care focused undergraduate nursing education program. We are one of a group of 42 other grant funded programs, but we are a bit unique because we are rural based and also because there were no registered nurses based in the rural health clinics in our program site, which is rural Page County, Virginia. We had to create the RN role for the purposes of the grant. Through the grant, we were able to hire 2 registered nurses who are here today with us, who work full-time year-round in the RHCs. And this is the focus of our presentation today. The education program is led by a full-time partnership liaison in conjunction with the RN preceptors. The goal is to increase the BSN prepared nursing workforce in primary healthcare sites, which are often overlooked practice sites for nursing coursework. Our students complete 150 precepted primary care-based hours as part of the UpCare program. To establish this program, we are developing and implementing curricular and primary care site-based interventions which focus on mental health and substance use disorders, chronic disease prevention and control, as well as focusing on the development and establishment of primary care RNs able to work at the top of their practice scope in the RHCs. The RN preceptors are essential to meeting the grant goals, but are also key to QI in the health system in which they work. We have other partnerships, but the ones we are focusing on today are 5 federally designated rural health clinics, henceforth known as RHCs in Page County, Virginia. The RHCs are part of the Valley Health Page Memorial System in Luray, Virginia, and the hospital itself is a designated critical access hospital with 25 beds. We work interprofessionally with JMU's Counseling and Psychological Services program, and of course, we are the School of Nursing. This is a photo. It's a beautiful photo of our main clinical sites. It is beautiful and mountainous in Northwest Virginia. It's bordered by Skyline Drive, and that's where all of our clinics are located. The county itself has 3 towns, and the clinics are dispersed among the 3 towns. Here's a map. You can see Page County in red in the upper left. It maps out rural-based facilities in Virginia. There are 7 critical access hospitals in Virginia. And also in the county are, you can see our 5 little green dots there, rural health clinics and non-urban federally qualified health centers, or FQHCs. Demographically speaking, the majority of Page County's population is white. We have a higher poverty rate in Page County than the state and national averages. We have less individuals with a college degree than state and national averages. But on the flip side, we have more people who do not have a high school diploma. And the younger populations, ages 0 to 19, are declining since 2014, but older males, 65 plus, have a population growth here. In Stanley, Virginia, one of the towns that I was talking about before, significantly, almost 50% of the households are below poverty line, or ALICE, which according to the United Way is asset limited, income constrained, but employed. Similarly, in terms of health outcome ranks, which indicate length of life and quality of life, Page County ranks number 67th out of 133. Page County is a medically underserved area and a health professional shortage area in terms of primary care, mental health, and dental health. And you can see that reflected also in its health factors outcomes. We are ranked 98th out of 133. These reflect rates of alcohol and drug use, diet and exercise, sexual activity, and tobacco use, access to and quality of clinical care, education rates, employment, income, family and social support, and community safety. And lastly, physical environment, which talk about air and water quality, as well as the availability of housing and transit. Gives you a brief overview. Here are some photos of the area. It's a pretty small area, about 25,000 people total, completely surrounded by mountains, so it can be a little isolated. There's no public transportation. The main means of income are rural, with farming, also the National Park Service, and tourism is a big source of income as well. And we also have a high rate of lots of chronic diseases like diabetes and heart disease, teen pregnancy, drug use, and suicide, unfortunately. And as you can see from the photos, it ranges from being a really beautiful, kind of quaint, idyllic place to also being impoverished and a little bit dilapidated and run down. In Page County, we do a lot with a little, and the rural health clinics are a big part of that. One thing that Tina will be talking about is that the rural health clinics are actually owned by Page Memorial Hospital, which is pictured here. And with that said, I'm going to turn it over now to Tina Switzer.
Hi, I'm Tina Switzer. I'm the partnership liaison on this grant, which means I have 1 foot in the School of Nursing at JMU and 1 foot in the community in Page County. As we talked about, as Erica talked about, this is our critical access hospital, which owns the 5 rural health clinics. What are our rural health clinics? They were created by an act of Congress in 1977. They have to be in a HIPSA or a medically underserved area, and it has to be a rural area. It requires the presence of a nurse practitioner, CNM, or PA at least 51% of the time that the clinic is actually open. And it gets cost-based reimbursement for all of its Medicare and Medicaid patients at the all-inclusive reimbursement rate. So Erica said that our clinics are owned by the hospital. Those are provider-based clinics, and there are also independent clinics, and their reimbursement is a little bit different. But basically what you need to know is that the reimbursement is cost-based, and provider-based reimbursement is a little more plentiful than the independent reimbursement. There are yearly visit minimums, and a visit is defined as a face-to-face visit with a qualified provider, which are the NP, PA, MD, DO. So there cannot be any reimbursement unless there is that face-to-face visit. There's minimal QI reporting at this point. And I could speak forever about RHCs, but I'm just trying to give you the nuggets of what are important in terms of what we're presenting today. But what we're noticing is that value-based contracts with third-party payers are actually starting to increase some of these efforts and the attention to these. And there was new legislation in 2020, which is actually potentially going to cap reimbursement for a lot of RHCs. Specifically, the provider-based reimbursement is going to start decreasing. But that said, in 2020, after the CARES Act passed, telehealth was finally able to be reimbursed in the RHCs. So when the Medicare expanded telehealth access for regular clinics, they could jump right off and do that. But we needed an act of Congress in RHCs to actually be able to provide that care and get reimbursement for it. So rural health clinics, we have 5 in Page County. This is a busy slide with a lot of information, but basically what you need to get from this slide in terms of what we were starting with was we don't have any behavioral health clinicians in our clinics who are embedded, and we have 0 social workers in Page County who aren't part of DSS. Our rural health clinics represent all of the primary care that's actually available to our Medicare and Medicaid populations. And before this grant started, we had 0 RNs in our RHCs, and this included our clinical leadership. Our clinical leadership are either LPNs or people with a business background.